Imagine being trapped inside a body that is failing you. No medication can help, and you don't have the right to say, I'm ready to go. According to the CDC in 2022, 1.8 million people are on hospice or palliative care, which means 1.8 million people are actually going through this in the United States. To respect human dignity and lessen suffering, all 50 states should legalize physician-assisted death. As a nursing assistant of 3 years with experience in hospice and long-term care, I have looked at residents in the eyes that are dying of active death. Though modern medicine is a blessing, it can actually prolong suffering instead of focusing on quality of life. Death is something that can tie all of us together in this room. One day we will or have looked someone in the eyes in active death. But when our time comes, I feel like we have the right to say and do what we want when it comes to our body. I want to show how this policy can honor and provide compassion to those who need it most, and also show that there are safe ways going about this instead of just thinking of it as suicide. This is a very hard decision, but if you have a terminal illness and less than 6 months to live, it could work for you. The U.S. law says that you can refuse life-saving medical treatment. Very Well Health, February 2026, says competent individuals do have the right to refuse life-saving medical treatment if they grasp the treatment and the potential outcomes of not taking that treatment. There is exceptions to this, like emergencies, and if someone isn't legally able to understand what they're doing with their own body. If someone has a terminal illness, usually people don't know if they're going to pull through or not. Many people do not want to go through the suffering of a terminal illness in the end stages of life. Physician-assisted death provides a compassionate and humane way to go out rather than prolonged agony. BBC April of 2025 says, "This is a story of how and why Wayne chose to die. He said, 'Some days the pain is more than I can handle. I don't see any merit of dying slowly and painfully hooked up to things like intubation tubes and feeding tubes.'" Wayne chose this route because he had watched 2 family members die of the same disease that he had, and he chose that he didn't want to do it. He chose to die with dignity and his family by his side. Other states have proved that there are safe and strict safeguards to protect those without the right mind. APA in 2025 says MAID has series and steps that people have to go through to make sure that their death is legal and ethical. The requirements include they must be at least 18 years old, they have to be a resident as to where they wish to want to die, they must have a prognosis of less than 6 months to live, the capacity to consent, and be able to administer the lethal dose without assistance. By explaining these steps, you know that not everyone can get this option so easily. And in some states, people also have to go through mental health screenings. As we look and hear stories hear stories of what people have gone through going through this disease, it's clear what the legal system must do. Today, legalizing physician-assisted death in all 50 states could honor our citizens by not letting them go through unbearable pain and suffering at the end of life. At the end of the day, it's not about choosing life over death. It's about choosing peace and dignity over pain and suffering. When a terminal illness has taken over, we should be able to decide how, when, and where we pass. I leave today giving you a reminder that thousands of people are stuck in their bodies daily. By standing and advocating for this law, we can make sure that people's pain and suffering is not what they want to go through. When you talk about dignity, Keep remembering that keeping strength is all the way to the end, but dignity is also about full control of your medical destinies.
Thank you. Now we're supposed to ask questions.
2 minutes.
Is assisted dying the same as assisted suicide?
Yes. Assisted death is a lethal administrative dose that you have to take yourself, but it's only for people that have a terminal illness and meet all of those required guidelines. So you have to have less than 6 months to live. It has to be legal in your state, which right now it's not legal in every state. I think it's only legal in probably like 15 or 20 states in the United States. But yes, basically.
Is there a difference between medical assisted or physician's assisted death and hospice or palliative care?
So in hospice, it's more, hospice is more focusing on the quality of life and just making sure that they're comfortable. Physician's assisted death is just ending your life there. It's once they've gotten to the point of hospice or palliative care, if they have the right state of mind, that's usually when it's most painful, and some medication you just can't overwhelm that pain. So usually people like to.
Are people allowed to pick where they would want to take that medicine at?
Yes, you can take it anywhere. So the hospital, your bedroom, you can be at your family's house, your house, anywhere, and anyone can be there. The physician will actually give you the dose, and then you take it home and you decide when you want to do it, but a nurse or a medical professional has to be there just in case someone aspirates.
Are the doctors in those states required to tell patients about medical aid in dying?
I am not 100% sure about that, but I would assume,
That it's illegal in those states?
yeah, it's illegal. People have those options, and especially if they're already in hospice and they have like hospice nurses and stuff, I would assume they would tell them about it.
Awesome.
Okay,
Thank you.
wait, don't pause it. Okay, wave.